Earlier today, I was at the Supreme Court to hear Chief Justice Roberts issue the decision on the Affordable Care Act. And while we respect the court, we respectfully disagree with the decision. Just because the court upheld the law as constitutional does not mean it is a good law. In fact, it's a terrible law. Unprecedented government power, fundamentally changing the relationship between the individual and government. And in fact, Chief Justice Roberts acknowledged that. The court ruled today that in fact the Affordable Care Act is a tax. It is the largest tax in America's history. We also know that CBO has estimated that up to 20 million Americans will lose their employer health insurance. It makes it harder for small businesses to hire. And as a mom and a wife making healthcare decisions like many families in America, we've already seen our premiums skyrocket, on average $2,100 per family. For all of these reasons and more, the American people oppose this bill. In fact, the opposition has increased since the law was signed 2 years ago. That's why the Republicans pledged to America to repeal this law. And we are more determined today than ever to repeal this law. The Supreme Court spoke today, but they won't have the final word. The American people will have the final word in November.
I'm Nan Hayworth from the Hudson Valley of New York, and I am a physician myself. I'm an ophthalmologist, and I had the privilege of caring for patients in the Hudson Valley for 16 years. And I'm here to represent patients and doctors across the country. My colleagues tell me that they are very concerned about their ability to deliver the care that their patients deserve and that they have come rightly to expect under the terms of this law. In particular, I'm worried about Medicare patients. As an ophthalmologist, you can imagine I took care of many of them in my career. This law, this 2010 law, takes $500 billion out of Medicare. This directly compromises their access to care. It is unacceptable. We are resolved here to honor the goals of that law, which were the right goals, to have good, affordable health care for all Americans, affordable, portable health insurance. The wrong law. We cannot afford to impose a $2 trillion bureaucracy on the American people, and we can honor those goals in ways that make sense. We are here to put patients at the center of healthcare, patients, their doctors, their providers at the center of healthcare, and not the federal government. And Kathy is exactly right. We are more determined than ever, and we will succeed.
Hello, Renee Elmers from North Carolina representing the 2nd District. Yesterday I said a new chapter will be written for health care as a result of the Supreme Court decision. It isn't the chapter I was expecting, but it is one that we will continue in the fight. I came to Washington because of ObamaCare. As a nurse and with my husband as a surgeon who is actually here in Washington now, we knew we had to fight against this for health care. As a mother, I'm concerned about our children. As a nurse, I'm concerned about our seniors. This decision keeps in place $500 billion being cut out of health care for Medicare for our seniors. And it also continues the Independent Payment Advisory Board, which will be 15 bureaucratic, unaccountable individuals who will make healthcare decisions for our seniors and for our citizens. The fight continues. The uncertainty remains. And the vision that has kept me awake so many times at night as a nurse, seeing myself holding the hand of a patient while the doctor comes into the room and says that their life-saving treatment will be denied because the Independent Payment Advisory Board deems it unnecessary, remains in my mind. We are and will remain committed to this. We will repeal ObamaCare, and this will continue to be our fight. And then the chapter for reform with efficient, accountable, responsible health care reform will be put in place. Thank you.
Thank you and good afternoon. I'm Anne Marie Burkle from New York's 25th Congressional District. While the court ruled that this is a constitutional law, that doesn't necessarily mean that it's good policy. I'm a registered nurse and since then a healthcare attorney. I've been in healthcare for most of my professional life. So healthcare to me is intensely personal, but also it's just I'm very passionate about it. Throughout the course of the last 18 months, I have had my hospitals, my physicians, I have had senior citizens, I have had nurses come to me and say, this law is bad, it is going to bankrupt us, it is going to affect the way we are able to provide care for our patients. So it may be constitutional, but it's not good policy. And as legislators, our primary goal needs to be enact laws that do what's best for the American people, that make sure that they have access to health care, that we do everything in our power to keep the cost of health care down. This law doesn't talk about tort reform. This law doesn't take any of the necessary steps to really reform the cost of health care in this nation. The president continues to say that if you like your health care, you can keep it. Well, I'm here to tell you, I hear from the folks in the district all the time, from my physicians, from hospitals, the concern that that's not going to be what happens. So many people and employers are going to put their employees into the exchange, and they will lose their choice for health care in the United States of America. That's unacceptable. It's unacceptable as legislators, and it should be unacceptable for the American people. So as was mentioned, today begins the fight. Today begins another debate. Today begins the true debate on how we are going to reform health care in the United States of America. Thank you so much.